Well, hopefully you're in the right place at the right time. This is the Aurora Health Alliance quarterly community meeting. I'm Heather Logan, and I am the chair of the Aurora Health Alliance Board of Directors. And I see that we have some staff present, as well as some other AHA board members, and then also a variety of different organizations. So if you would be so kind as to drop your name and your organization in the chat and just say hello so everyone knows what organization you're with, that would be wonderful. We also wanted to say thank you to our affiliates. Affiliates are what really keep AHA alive and running. We have a variety of affiliates that you can see here on the screen that donate and give money to AHA. So if you are not currently an affiliate and would like to learn more about how to become one, you're more than welcome to reach out to myself or our executive director, Mandy Ashley. There's also the opportunity if you want to host or sponsor a meeting, or host or sponsor a interest group meeting. We welcome that as well. We have a variety of different meetings outside of the quarterly meeting for different topics such as kids, older adults, seniors, access to specialty care, behavioral health. So there's also the opportunity to sponsor one of those important meetings. So to kick us off, AHA has some exciting news, which is that we finally, after grueling months, came to a good place with our equity statement. And it happened, through board meetings and really trying to find the right words that really articulate how AHA feels about equity. And so we would really like to start incorporating our equity statement and reading it at our quarterly meetings, as well as within our interest group meetings. So I'm going to go ahead and read it to you right now. The Aurora Health Alliance's commitment to health equity means we strive for and promote the highest possible standard of health for all people. To Aurora Health Alliance, health equity means everyone has a fair opportunity to be as healthy as possible, regardless of race, ethnicity, socioeconomic status, gender, sexual orientation, immigration status, language, physical and mental disability, and other core aspects of identity. It requires the dismantling of structural racism through the removal of barriers to health. It requires both improving access to the care and resources needed to thrive, along with equitable treatment once that access is gained. So we're happy to get to a great place with our equity statement, and we would appreciate your feedback, your thoughts on it, what resonated with you, if you feel there might be something that we could tweak. And I believe that Mandy dropped the equity statement in the chat. Great. So we're going to go ahead and switch over to our Did You Know panel. And so I'll hand it over to Joe to go ahead and introduce our panelists.
Great, thanks, Heather. Welcome, everyone, and thank you to our Did You Know panelists. We have 4 speakers today. We have Stephen Burton from the LGBTQ Hub, Brandy Lockhart from the Safe Babies program, Meghan Prentiss with Tri-County Health Department, and then Mandy Ashley will be giving updates from Aurora Health Alliance. So we're going to go ahead and start with our first speaker, Stephen. Go ahead and take it away, and I will throw you a message in the chat at about 8-ish minutes or so, just to give you some warning.
Okay. Thank you so much for that introduction. As I mentioned, my name is Stephen Burton, pronouns he, they. I lead the LGBTQ Hub, which is on the Anschutz Medical Campus. With that, this program was created within the Office of Diversity, Equity, Inclusion, and Community Engagement within Dr. Regina Richards' office. And so we both simultaneously work together to basically are committed to transforming, advancing policies and programs and practices that address social injustice, citizen health disparities alongside the communities we serve. The LGBTQ plus hub is directly focused on providing services and really connecting a lot of the services and resources that's on the Anschutz campus for all LGBTQ plus students, staff, faculty, and also for allies community as well. And this is an opportunity that kind of wasn't there before previously. They did have on the Anschutz campus some student-led groups. However, there wasn't any official like campus-wide initiative. And that's where the hub kind of comes in. And I know we're using kind of the did you know format. And so that being said, I did want to ask, did you know that we do provide free trainings? That's not just for student, staff, faculty on the Anschutz campus, but it's also open for the community members, for anyone to basically come in and join in. We provide trainings. Right now, we're really focusing on LGBTQ plus 101. Thank you so much for that. And we're really focusing on that baseline general understanding for a lot of people. And that could be trainings around pronouns, the difference between gender identity, gender expression, or just a wide umbrella term of LGBTQ plus, and providing better understanding for those. You can also sign up for these on our website as we provide more training. And another question is, did you know that also the hub has an advisory committee? We have 5 different ones that's open to all, including community members as well. We have things such as research, community and events, support and resources, government and leadership, if you wanted to help lead the hub as well. And then we have our education advocacy, which is over training. Each one of these we meet once a month, and it's about just an hour meeting. If you would like to join those, we do have a listserv. If you're not able to make any of the advisory committees, you are able to at least be updated and keep up to date on what we're doing on the Anschutz campus in regards to the LGBTQ plus community. I'm not sure if the slides are rotating. Yeah, if you go to at least the last one. And those are our logos as well on the previous slide. Yeah, so at least on the bottom one. So we're directly within the Office of Diversity, Equity, and Inclusion. But for us, the hub, we have our tagline or catchphrase that we use is be seen, be connected, be an ally, be you. And that's really something with our initiative that we push off with, is making sure that we allow for this community and for allies as well to be seen, to make sure they don't feel as isolated, to be connected. There's kind of an issue we do run into on the Anschutz campus because it's so large, is that a lot of departments and initiatives and programs going on, they don't necessarily communicate with one another. And so we're really centralizing a lot of that effort within the hub. And if you're new to being an ally, if you want to learn more, you can always jump in on advisory committee or trainings or some type of fun activity that we host. You can always do that as well. And on the next slide, and these are just some of the did you know questions. And that first one is our mission statement. And is that, did you know that the Anschutz LGBTQ plus hub was started to create and maintain an inclusive campus environment for LGBTQ plus and ally students, faculty, staff, patients on campus and within the Aurora community. And that's, as I mentioned earlier, is not just for the Anschutz campus, it's also open for anyone that would like to just chime in, learn some more, or provide any feedback or suggestions as we are pushing forward to make the campus more inclusive and supportive of the LGBTQ plus community. And that's what I have for now. And then, yeah, I just kind of want to open up if anyone has any questions. I'll be happy to answer those as well.
Awesome. Thank you, Stephen. Yeah, we do have a couple of questions that came through. One question was, what trainings are most requested from your organization?
At the moment, most of all our training is focused around LGBTQ plus 101. So that's kind of, there's so many ways we could have went with the trainings we decided to go with, but based off just requests that were sent in, a lot of people are just trying to get some basic understanding. And the trainings we provide is offered to either if a particular department would like to have it, or if a particular program, or if even individuals, like if you wanted to come in and get a training, we have like certain days that are designated to provide trainings. And then if you're part of a school or department, you can request, hey, we want a isolated training just for us. And those are kind of right now, just any base general understanding.
Great, thank you.
Mhm.
Another question came through. How is the hub including staff at hospitals?
At the moment, most of those are through the advisory committee that we have. It's not just for students, so staff, faculty, anyone can be part of those. And that's we have over 100 people that's on the different advisory committees we have. And for those that can't make any of the advisory committees due to their schedules, then most of the people are joining the listserv or just an email list. And so they're able to send in any information, suggestions, or feedback via the LGBTQ plus hub email. And that's kind of the way we're kind of keeping people included, if anything. We just want to make sure it's more community like driven initiative and not just necessarily one or two people controlling everything. So yeah.
Great.
Mhm.
And I attended the open house that you had over a couple of days. It was so well done and really excited to hear about this program. How can we help support the efforts that you're doing, help spread the word? How can we support you best?
If anything, like the best way is for sure joining more trainings and just being part of that initiative, that push to make the entire campus more inclusive. Is providing feedback. If you can send in, if you join a training for sure, we have like post surveys as well, do those. But if you can send in any suggestions or any complaints or things like that, so we can be aware of any issues or gaps that we're not providing in services. I could put the email in the chat real quick. To me, that would be beyond helpful. We do have a few community facing like events coming up, like there's the Aurora Pride event on August 7th. Coming out to those, just being part of like, I guess if anything, like reaching out to the community and talking with the Anschutz staff and students, that would be the best. But also just partnership. If you know of other organizations that would like to do some type of partnership with the hub or the Anschutz campus, you can also reach out to us and we will be more than happy to set something up.
Great. Thank you so much. We have one more question we'll put in there. How do you define an ally? It's a big one.
Because it can vary depending on who you're talking to. So me personally, like an ally is more of a verb, it's an action. It's not like a one and done statement, like I'm an ally. Like you have to actively continue put effort into supporting the LGBTQ plus community, not just the LGBTQ plus community. Anyone can be an ally in different communities. But it's more so of if you have a privilege or if you're outside of the community, it's being able to stand up for this community. And also people within the LGBTQ plus community can also be allies of other members within that community. There's a lot of like, say, for example, biphobia. So things of like gay and lesbian can support the bisexual community and being able to stand up for that community. And not just having kind of that bystander kind of, I'm not going to engage. It's more so like engage, like let people know that these particular conversations that you might come across isn't okay, that you're actively trying to learn and you're also self-reflecting on your own biases. To me, that's being an ally. You're not just waiting for someone to reach out to you to do something. You're actively doing something.
Thank you. Thank you for that. And thank you for the information and for your presentation. And Stephen's put the LGBTQ plus hub email address in the chat. And thank you very much, Stephen, for your time and the information. And congrats on this great organization and what's all the work you've been doing. So thank you.
Thank you.
All right. Great. Next up, we have Brandy Lockhart with Safe Babies Court.
Hello, thank you. Well, that's weird. That wasn't actually the slide I submitted, but okay, interesting. So now I'm off my game. I'm so sorry.
That's
we
okay.
can adapt to. I can stop sharing and you can start sharing if you have it pulled up. That's totally fine.
I don't know that I do, so it's okay. I mean, it's just a first slide that just says Safe Babies Court and stuff on it, and gives my email address, but I can put that into the chat later.
Apologies for that.
Okay, well, so my name is Brandy Lockhart, and I am with the Rocky Mountain Children's Law Center. We are a legal advocacy agency, and one of the programs is the new Safe Babies Court initiative. The Law Center started with a babies court in Pueblo County about 3 years ago, and in the last 2 years has now been working with folks in Arapahoe County to bring it to Arapahoe, and we finally got to launch. We started screening for cases in March, and so things are moving along quite well. So did you know that every 6 minutes a baby or toddler is removed from his or her parents' care due to abuse or neglect and sent to live in a new home? Did you know that infants and toddlers are disproportionately overrepresented in both maltreatment and foster care entry rates? For young children, this threat is arising at a crucial time in life when their early experiences are shaping the brain's architecture into foundations for learning, health, and future success. So the Safe Babies Court program is a community engagement and systems change initiative, but it really is getting involved at the court level. When court involvement is necessary for a family, the approach is focused on enhancing the court and child welfare's response, and the community's response to the unique needs of infants, toddlers, and their families. And this is using the science of early brain development. We know that the first, well, I guess I should frame that. Did you know the first 1,000 days of life are the most critical in the development of a child? So you can kind of click through. And yeah, you can keep on clicking until all of those are up. I'm sorry, I didn't realize I had given you guys one that had all the click-throughs. Okay, stop there. Yeah, so researchers have identified, the prime, most optimal time of development of particular things for babies. So language, sensory pathways, higher cognitive functions, and self-regulation. But we know that trauma, abuse, and neglect create issues in the foundations and the formation of these things. We also take this into account when we're working with the parents in our program, knowing that their brain development, because most of our families have had abuse and neglect or extreme trauma in their backgrounds as well. Almost 70% of families who come into Safe Babies Courts nationwide have an ACEs score of 4 or more. I don't know if you're familiar with ACEs, that's the Adverse Childhood Experiences. If not, definitely Google it and do that assessment for yourself to be aware of your own adverse childhood experiences. But what we know is that this can really affect children's development. And so we want to get in and help make the child welfare system a friendlier place for babies and young children. And you can switch to the next slide. All right. So this is an initiative of the National 0 to 3 organization. We receive our grant funding through them and their grant funding through the U.S. Department of Health and Human Services. And the first Babies Court was initiated in 2005. And of course, we are one of its most recent grantees. Sorry, I got myself all mixed up here. All right. And the goals of Safe Babies Court team approach are to protect young children from further harm from the system itself, to address the damage that has already been done, and to identify and address the structural issues in the child welfare system and in the broader community that prevent families from succeeding. So such as access to services, transportation, funding issues, and other things that can really get in the way of families being successful in increasing their protective factors and their parenting capacity in order to be safe parents for their children. So the Safe Babies Court team is prioritizing assessments. We are working on expedited referrals so that all of our children who come into our docket are getting like child find assessments or some kind of developmental assessment within the first 30 days and are starting to receive early intervention services earlier. We are working with Tri-County Health and the Nurse Visitor Program is involved in each of our cases. One of the cornerstones is child-parent psychotherapy and making sure that we're addressing the parents' underlying traumas as well as how that presents itself in context to the relationship with their child, so that they can heal that, or they can come to the understanding about where they lack and are not able to be the best parent situation or caregiver for their child. So nationwide Safe Babies Court team programs are seeing faster return homes, more return reunification with parents or placement with biological family members than is the national average. Permanency, which is being fully into a home, those rates are double the national average for Safe Babies Court teams. They are seeing 0.7% recidivism in the first year, whereas the national average is over 9% recidivism in the first year after a case closing. So there are really positive outcomes, concrete outcomes that they're seeing for families and babies whose families are coming into this program, because we are making sure that we are having the case plans be customized and tailored to the family's particular needs. One of the hallmarks of the Safe Babies Court team is meeting parents where they're at. Again, so that is customized family treatment plans instead of, oh, the reason they came into care is substance abuse, so that must be what we need to be having them go to service for. Yes, that is likely, but we're doing assessments on the front end much, much sooner and outside of the scope of just what the safety concern is that opened the case, but more broadly looking at what's going on for the family, so that we can understand and heal and fix and provide supports and different community resources that are going to work for that particular family in their particular situation to be the best parents that they can, and hopefully either get their children home or be in a situation of acknowledging that they aren't the best place. So nationwide Safe Babies Court teams do see less contested hearings for permanency and less contested hearings for termination of parental rights. And they see more relationship between the resource families. So whether that's foster care family or kinship providers, you're seeing more relationship happening and being cultivated there as well, so that if the situation arises where the child cannot go home to the parent, we're still trying to keep relationship intact so that the child still has some connections to that family, as is safe. Some of the main differences in the Safe Babies Court program versus the child welfare system, traditional cases, the biggest are we have monthly court reviews versus court reviews held every 90 days. And we have monthly family team meetings versus every 90-day family meetings that are held with DHS. So the 0 to 3 and Safe Babies Court kind of tagline is nothing about the family without the family. So what we're looking to do is make the family part of the team, part of the decision makers, because it's their family and their children, and we want to empower them and give them the voice and them the decision making and problem solving skills by being a part of the professional team, so to speak, so that they can carry those on with them after case closure. And when they have more opportunity to have voice and decision-making power, there's a lot more buy-in for parents, and they tend to attend their services at much more higher frequency, as well as their family time with their children. And they move through their treatments much more quickly and have better outcomes, or like I said, are coming to the understanding that they may not be the best option for their child. Some of the other outcomes, as I've mentioned, is reduced recidivism, which we see as prevention work as well. Greater access to early intervention services. And part of our work is making this a community-based approach, taking the onus off of the court system and the child welfare system alone, and not assuming that those are the systems that need changing, but understanding that it's a wider community system that must be addressing the issues of young families, of these young children. And so we really work to develop larger support and services systems around our families than what the traditional child welfare case might do. So that includes getting creative around community centers and faith-based communities and resource centers and different things like that. So those of you on the call, if any of what I'm saying is resonating with you as something that you would want me to know about what you do to possibly have families get to you and your services, even if they're not necessarily what you would think of as normal child welfare type things. We're really working on expanding just the community reach around these families and getting them connected to more community supports so that they're not having to fall into the child welfare system for supports. Any questions? I went very fast. I also do a much longer and more in-depth for anybody who would maybe be interested in that at another time.
Great. Thank you, Brandy, very much. And apologies for that missing slide there, and thanks for pressing on. So thank you very much for, for the great information. We did have a few questions come through. So let's see if we can take a few of these. How is it determined that the court needs to get involved in a case?
Right, so we are just another arm of the Arapahoe County Department of Human Services regular court process. I actually work with the Rocky Mountain Children's Law Center, so I'm a completely neutral party. So I'm not part of the department or part of the court system. So I'm more kind of a consultant and somebody who gets to just, work in all of the systems. So cases are coming into the department as they normally would. Someone has a concern of abuse or neglect and makes that report, and the department does their normal assessment period. It's when the department has decided that a case must move from just that assessment period in their intake unit to a full court case, that then it could possibly become a Safe Babies Court case. Our cases are all the child must be between the ages of 0 to 3. Currently, we're only accepting cases where the child who is 0 to 3 is the only identified child on the case. Some of the things we are not accepting are physical abuse. Egregious harm is actually the term, not just physical abuse, because we do some physical, but not real strong egregious harm cases. No sexual abuse cases, and no cases where there was a child fatality and then there's just the infant left in the home, because there are a lot more dynamics and usually criminal issues going on with those, and they don't necessarily work with the level of parenting and child contact that we're trying to do, and the real healing of the attachment and bonding relationship. Sometimes we can't do that work when the parent is incarcerated. So those are families that we are not working with. But if they fall into our other criteria, then it is an optional program. Their attorney is the one who introduces it to the family, and if they're interested, then I call them. So far, we have had 5 families who have been screened into the program, and all 5 have consented and are a part of the program. We see it as a no-brainer. Of course, you'd get into this program because you're going to get so much more support, and your case is going to be really looked at and communicated about and moved forward a lot quicker. But not all families are in a place where they're ready for that. Not all families are in a place where they can accommodate monthly court reviews and monthly team meetings. So this is an optional program for families.
Great. Thank you for that.
This is Sarah Young with DentaQuest. Would you prefer that we submit our questions through chat, or can we ask them live? What's your preference?
Either or. Yeah. Did you have a question, Sarah? Go ahead.
I did. Brandy, thank you so much for your presentation. And I'm just wondering, can you talk a little bit more about how information around oral health and access to oral health, is it part of just the screenings that the families already go through? Do you feel like you have the information to be able to provide to families to support that type of access to making sure that their oral health is also part of their whole health?
I would definitely love to connect to get more information and do more on that. Yes, absolutely. Yeah, and the social determinants of health are really important to this approach as well. And looking at that, we really view that as vital community members. Dental health is vital, and it's vital in making sure that children are kept safe within their families as well. So yeah, we definitely want to be including that realm and providing that information to our families as well. We do ask monthly questions of the families. I have a database with 0 to 3 that I have a lot of data points that I have to hit, and we're always asking about well child appointments, doctor's appointments for the parents as well, really making sure that our moms who are moms of newborns are getting back in for their postpartum appointments and things like that. So we are asking about medical health, dental health, developmental type appointments, et cetera. But I would love more information to provide families as well, if you'd be willing.
Yes, let's definitely connect. I'd love to be able to provide some support. We administer the Medicaid and the Child Health Plan Plus dental plans here in Colorado, and have lots of really good information, and would be very happy to work with you, and or if it's even appropriate to be able to present to some of your families. That would be great.
Yeah, absolutely. Great. Thank you.
Great connections being made. That's what we like to see. If Brandy, if you wouldn't mind putting your contact information in the chat, that would be great. That way folks can continue to reach out to you. Thank you again for all this great information and the great work you do. And we will, and also just to remind everyone, we are recording this, so we will send out the link, and it will be on our YouTube page so that folks can go back and revisit all this great information you're hearing. So Brandy, thank you so much.
Thank you.
Great. All right. Megan, you are up. Meghan Prentiss with Tri-County Health Department.
Hi, everyone. My name is Meghan Prentiss. I am on our medical countermeasures branch, which is fancy for saying vaccine for COVID-19 at Tri-County Health Department. I've been on our response for the last 16 months and was started out in community testing, and now working on vaccine and trying to make sure that we have equitable access to vaccine. Same with testing, just making sure that those sites are really culturally appropriate, languages in the, or information is in the language, and services are in the language and culturally appropriate way that our communities need. And so I've been really helping out formulate our strategy around vaccine equity. We've been doing a lot of this work the whole time throughout the response, and then that's been a key pillar of that work. And now we're working more directly in our local neighborhoods to bring vaccine to where we're seeing really low vaccination rates. And so excited to share some data with you and a dashboard as well. And there we go. So did you know Tri-County has prioritized 3 neighborhoods to focus extra resources on vaccine? So as I mentioned, we've got lots of resources that are going out to everyone in our jurisdiction focused on vaccine information and communications. But we've looked at the data and realized that we have 3 neighborhoods that are the furthest behind in vaccine access and vaccine rates. And also looking at 6 different key indicators to identify those neighborhoods. Those included case rates over the past couple of weeks, death rates, hospitalization rates, vaccination rates, which are heavily weighted since we are talking mostly about vaccine, percent of the population at or below poverty, and then also the percent of the population that is non-white and or Hispanic or Latinx or identifies that way. And so with that data and those rates, we were able to look at some neighborhoods on a dashboard that I'll show you all here in a minute And there's these pink census tracts that are popping up and saying, hey, these are the furthest behind in vaccine and in all of these areas. And actually, if you could go back, sorry about that, Joe, or whoever's advancing. So looking at all of those indicators, and we had certain, we do it by census tracts versus zip codes, but those census tracts were continuing to pop up in the same neighborhoods. So even with those rate fluctuations, maybe one census tract would be highlighted one week and then another the other. For the most part, we were seeing it show up in the same neighborhoods. And so those neighborhoods that we've prioritized are Federal Heights, Commerce City, and then Aurora. You'll see on this map, we've got 4 different colors, but 2 of the colors, the red and the blue, are Aurora. We just have Adams County and then Arapahoe County broken out. You'll also see that there's a little block within Aurora that is not included, and probably other areas that you all would identify as Aurora. We did that on purpose. So looking at those rates, again, we're looking at where were folks the most behind on those vaccination rates. And if folks were already ahead and those vaccination rates were already pretty high, we were looking at a difference of maybe there was 20% versus 55% about a month ago. And so those ones that were at that 55% rate, they obviously weren't as behind as others. And so we kind of cut out some different census tracts based off of the data and where we wanted to focus those extra resources and efforts. If you could click twice or 4 times. All right. And so vaccination rates, or did you know, vaccination rates are as high as 68.05% and as low as 33.65% in some parts of Aurora. As I mentioned, we had some areas that were as low as about 20 or 21% about a month or 2 when we were looking at this data. And you can see on the chart here, it's a little bit small, but the light blue, green, and then the first yellow color, that is Aurora. So the Adams and Arapahoe, again, we have those sort of broken out separately, just so we can see the data by county. And this is 18 plus. We're working on some data to get the 12 plus into these particular graphs. But we do have that on our dashboard, which I'll show soon. But you can see that Adams County and Arapahoe County, those are those top 2 lines. That's the total vaccination rate across the whole county. And you can see it slowly sort of flattening out over the last couple of weeks. So this goes through July 9th. And then on the bottom are the 3 priority neighborhoods, and then broken out Aurora again into, so we've got 4 lines of trend. And we're seeing that those are still staying, they're still increasing more than our 2 counties. And the reason, or what we think is the reason for that, is a lot of the work that we've been doing with many of you, our community-based partners that know these communities really well, that are doing navigation in the different neighborhoods and helping people find a vaccine site, helping to answer those questions that they haven't found in the language of their hearts, or in a culturally appropriate way, or they just still have questions that they haven't been able to ask a provider because they don't have access to care. All those things that are coming up in those one-to-one conversations that still need to be had. And so all of that work that our partners are doing, all the extra resources that we're putting into the community, especially over this past month, on top of all the work that was already happening, we really think is helping to help make sure that those lines continue to trend up and hopefully eventually meet our Adams and Arapahoe County lines there for vaccination rates, getting everybody to at least that 70% is the goal. So really our goal is to reduce the gap in vaccination rates in our hardest hit communities. Then next slide. So we can also see that here. So we had that trend line. So Adams and Arapahoe counties are there on the bottom in the blue and gold. And you can see that the increase in vaccination rate since June, so this is for the month of June and coming into early July, increased by about 4.12% in Adams County and 3.34% in Arapahoe. And in those communities that we're working in, we're seeing almost a doubling of those vaccination rates. So still continuing to increase those, making sure that we've got vaccine events and that education. And so we think that's really helping to contribute to this increased rate. And again, not just us, but all the work being done by you all and our partners, and that we're continuing to work on and try and figure out why are we still seeing the gap? How can we improve this? How can we get out in those communities and reach folks with the information and vaccine that they need. And next slide. So part of that and how we sort of bucket some of the work that we're doing is, did you know Tri-County has 3 strategies to address the vaccine gap in Aurora and our other 2 priority neighborhoods. And we look at this really across all of our work in vaccine, but this is how we've been framing it with a lot of our neighborhood groups that are forming and partners that are working in these specific areas. So first we have our base of this pyramid is providing that culturally appropriate communication on prevention. So we know in these areas, we have really low vaccination rates and really high case rates, which means we have more people that are prone to getting COVID-19 that are unvaccinated. So we really want to make sure we're still communicating the message, the safe 6, so wearing your mask, staying 6 feet apart, et cetera, getting tested, all of those things that we've been talking about throughout the whole COVID-19 pandemic, because it's still really important for these communities as they're not having those higher vaccine rates or vaccination rates. The second part of the pyramid moves up to providing that culturally appropriate vaccine education and navigation into existing sites. So again, making sure that folks are getting the information that they need to answer those questions that they still have around vaccine. And we're doing that a lot with our partners. We've got paid navigation partners in the community, as well as other partners that are just doing this anyways, because y'all are awesome. But partners that we're just continuously disseminating information to about COVID-19, about the vaccine, helping to answer questions, providing office hours so that if questions are coming up in the community and y'all don't know how to answer those, we can help. And then also, again, that navigation into existing sites. So there's a lot of really great sites that exist. We have the Aurora Municipal Center has been running for a while, a Village Exchange Center, Stride Health Centers has been providing vaccine. And a lot of little pop-ups that have been happening between CDPHE. We've been working with RTD and HUD to also bring vaccine into communities. And so a lot that's already happening, and we want to make sure that people know about it and know where to go when they are ready to make that choice around vaccine. And then the last piece is this deploying new vaccine, the top of the pyramid. And this is on purpose, the smallest portion of this pyramid. We are at a point in the response where or in COVID, where we're not seeing those mass vaccination sites, and we are needing some more localized sites to really address the needs of some smaller micro communities and neighborhoods. So we are doing a little bit more of this, but it's still smaller because we want to make sure that, again, people know where to go already. There's a lot of sites, a lot of availability of vaccine out there. But if we have areas that really need a specialized site, or gosh, people would get vaccinated if it was just there and it was convenient, which we know is still a huge factor for folks. So coming to businesses, we're going to affordable housing complexes and mobile home parks. We're going to events like 4th of July festivals and all of the county fairs. So really making sure that availability is there where people are at and places that they're already planning on going. And next slide. Oh. And so we do have our dashboard that I'd like to share with you all. Perfect. Share my screen here. So this is what we call the COVID-19 Equity Assets and Gaps dashboard. It's called Assets and Gaps dashboard because we're not just looking at where we're falling behind on vaccination rates, but we're also looking at all the great assets and the community partners, organizations, businesses in our communities where we could also be partnering up since you guys know your communities best. And so we've got a lot of different layers in here. I'm going to scroll in. And as I mentioned, we've got a lot of areas that are popping up as in this pink color. And these are priority census tracts. But we've kind of grouped them together into those priority neighborhoods where we know these things are shifting and moving around day to day because it's all based on rates. But we know these neighborhoods are most in need because they continue to pop up in that neighborhood. As you click around in here, we've got some great data that pops up over here to the left. And you can see I'm clicking on this one in Aurora. This is our #1 priority ranking for Aurora. And so it's on the Adams County side, but we all know people don't know what county they're in. And so it's all part of Aurora. It's on the Colfax corridor. And this is coming up as #1 priority. The vaccination rate here is 35.59%. So we still have quite a ways to go. And this is one of those neighborhoods that's furthest behind. But we know that just because we place something here doesn't mean it's also not going to affect some of these other neighboring census tracts as well. So we're looking at other areas. This one happens to be number 2 in priority rank. They might have a higher vaccination rate, but they also probably have some of those other indicators showing up, such as poverty and people who are non-white or Hispanic that might be changing that, or maybe they have really high case rates in this area as well, which is why it's coming up as number 2. As we look at this also, we've got a lot of little dots and colors. So the blue dots on here are our providers who have provided vaccine in the last month. And so this is any of the pharmacies, FQHCs, or federally qualified health centers, and community-based organizations that might have a site located there. And then we have community sites, which are these purple dots. And so Village Exchange Center shows up on here. Down here we have the Aurora Municipal Center providing vaccine. And we have another one up over here. So Aurora Economic Opportunity Coalition, that's just starting to provide some weekend clinics as well. So they reached out and said, hey, we've got some clinics. We don't have anything on weekends. How do we get vaccine for our communities? That's when they're gonna go. We also have some green dots on here. These are a lot of our navigation partners. So those partners that are helping us to make sure that folks know in their area where to go for vaccine when they come in. And also we have some of the CDPHE pop-up events too. So we have upcoming events that are coming up. So future pop-up events. We also have a layer on here that we can add that shows past pop-up events. So we know where have they already been, where are they going, how can we make sure we're not duplicating efforts as we set up new sites or education in areas that maybe they already got everybody vaccinated. So a lot of different data in here. There's a lot that you can view in this panel, a lot of resources. We've worked with Adams County and HUD and RTD to add some specific layers on here. So mobile home parks in Adams County are on this, all of the HUD properties as well. And so just want to point this out as a resource for you guys as you're thinking about vaccine, talking to your community members, looking for those community-based sites that might not be on the CDPHE website when you're trying to find something, but it is on the Tri-County website, and it's also on this map. And then we're also happy to add things. What are we missing? What else would you guys like to see on here as we're thinking about vaccine and trying to address these gaps in the community? And then I'll leave you with, on this, I'm actually gonna stop sharing my screen and put up the contact information here. But we do have a whole team that's dedicated to Aurora and working in this particular neighborhood. Kathy Stotts, who I think a lot of you know pretty well because she's on the board here, she's leading the effort for Aurora. And she'll be the primary contact to reach out for any questions or if you want to get involved. If we haven't already been in touch with you in some way, we'd love to hear what you're doing, what assets have you brought or what assets are you seeing in the community that we don't know about? And then how can we help address this gap together? And we'd love to do that with you all. Again, if we're not already, I see a lot of familiar faces and names on the screen just from previous partnerships and partnering in this work. So thank you guys for helping out throughout this response and putting all the extra hours and blood, sweat, and tears, I think, into all of this work. Thanks to Barb for plugging the link to our map into the chat. She's also on our mobile team, so Tri-County can also go out as a mobile team and help out with any vaccination events, but we can also pair with the right, Tri-County is not always the right face to be at some of these events with these community members, but maybe it's a Stride or a Salute or another partner that our community might relate a little bit better with. So we're always trying to find the best fit and help connect those resources as well. And with that, I'll leave you with Kathy's information, but you're also welcome to reach out to me if you have any questions. I'm typically the regional health connector for Adams County, but I can try and do my best to answer any questions about Aurora and the work happening there.
Awesome. Thanks, Megan, very much. Yeah, I encourage you all to check out the map, that link that Barb put in the chat. Thank you. It's really, really well done and really helpful to have that visual to see where those particular spots are. And, you know, as Stephen mentioned, there's Aurora Pride coming, so there are events happening. So if you've got ideas of events and thoughts about other places where we can plug in vaccination sites, reach out to Kathy or Megan. So they're doing some great work. So thank you so much for that information. If you have questions, we had a couple of questions come through asking about comparing our vaccination rates, both those counties with Denver County, and then how Colorado's looking versus other states. So if you have some info on that.
Yeah, I have to say I'm a little behind on the national news these days. I've had my head pretty in the weeds for our local counties. Across the metro area, I would say that Adams County and Arapahoe were still a little bit further behind than other metro area counties. A lot of that reason too is, as you guys know, we have a lot of school districts. We don't have just one health system. There's just a lot happening. We have a lot of really great partners, and we're not all, as much as we try to connect, we're not all in one system working together all the time. And so I think a lot of that contributes to our rates being a little bit further behind. Not to say that Denver doesn't have its pockets like what we're seeing, where folks are further behind than the overall rates for Denver. And then also to just thinking about our populations that we have, especially in Aurora, we have the most diverse population, you all know this, across the state. And also a lot more people in poverty, a lot of health issues, and a lot more happening with our population versus some of the other metro area counties. And so that also contributes to that. We've got families working multiple jobs. They have kids, they've got a lot happening in their family, and also just don't have time to go because of all of those factors that play into their everyday lives. And so again, we're just trying to make it as convenient and easy as possible. And then also knowing we have those diverse populations, making sure that they have the information that they need in the way that they need it. That might be a little bit different than some of our other metro area locations.
Great, thank you. All right, let's see if we have any more questions coming through. We did have a question about efforts to outreach the undocumented residents.
Yeah, so we work with, I touched on it a little bit. We have several partners that we work with a lot of our Hispanic populations, especially, so that are often undocumented. And so folks like Kids First, Servicios de la Raza, Clínica Family Health, Salud, Stride, those folks that tend to serve those populations the most. And then also some of our refugee and immigrant serving organizations as well in Aurora. So we're very much connected with those groups and working through them to provide that information around vaccine, making sure that we are reaching those populations. And even with, you know, one example, Clínica Family Health, this is more Adams County, again, I'm coming from that lens. You know, they go out and they text. We know that texting tends to work best. Not everybody has internet. And so they text folks in their zip codes about the different events that are happening up near them. And we know that that's reaching a lot of that population as well. And so it's not necessarily Tri-County always reaching out to those groups, but it's often those partners that know those communities and work with those communities regularly that we're asking for their help and providing and helping them to be able to provide that information.
Great. Thank you. And thank you again for your presentation and for the great information. Again, folks, if you have a chance to check out the Equity Assets and Gaps map, it's really helpful. And all right, so now we are turning it over to Mandy. It's our last presenter.
Hi, everyone. My computer kind of freaked out in the middle of that. So I'm just making sure that I'm not in presenter view. I'm in normal view. Joe?
Yep, you're good.
Awesome. I know that these meetings, any Zoom meeting in the afternoon can get long. So I'm gonna stretch, feel free to stretch. Just wake up a little bit. I'm excited to share some information about the Aurora Health Alliance. We don't always get the opportunity to share updates because sometimes there is so much participation during a meeting that we save ourselves for last and then time is up. So I wanted to get in here and share what we have going on. and to experience what it's like to be on the Did You Know panel from the opposite side. So did you know that Aurora Health Alliance is evolving? In the past year, the board of directors has revised our mission, and it's similar to what it was, but now it reads to achieve equitable access and to promote healthier Aurora for everyone. It's a little bit more simple, it's a little bit more direct, but during that process, the board realized, oh, we should probably define what equitable means. So now we have an equity statement. Heather read that earlier, and for the sake of time, I'm not going to read it here. I did provide that link, but we're excited to be more thoughtful about our work with health equity, and we welcome any feedback on helping us to stay true to that equity statement and that commitment. Did you know that AHA is continuing to grow? We have been around for 12 years and we currently have over 3,000 members. Did you know that to be a member of the Aurora Health Alliance, it doesn't cost anything. Just agree to give us your email, you receive our information, and when possible, you are participating like all of you here are in our meetings. So if you have anyone that you're working with, in contact with, that you think would benefit from the things that Aurora Health Alliance is doing, please let us know. And did you know that we have affiliate organizations and sponsorship opportunities that keep us going? So thank you to all of our affiliates. Again, Heather mentioned this at the beginning. She's kind of reading my mind, which is awesome to be on the same page. But an organization can sponsor our interest groups or newsletter. All of those opportunities allow an organization to super be highlighted. We provide links and all of those things. Did you know that as an individual person, you can also contribute to the Aurora Health Alliance? Those affiliations and sponsor or individual contributions are tax deductible, the sponsorships are not. Did you know that AHA is responsive? Let's talk about COVID-19 and the year that was 2020. Bobby Joe, our communications staff member, she switched our meetings to all virtual nearly overnight. I remember it. I think I have not nightmares, but flashback memories to March 2020. And I'm super impressed with how our members adapted with us. Did you know that now we do webinar series, we do videos, and we have a YouTube channel? So the webinar series that we did in 2020 are listed on this site. And currently and still we are virtual because our attendance at these meetings is great. And people aren't wanting to travel across town always. So we're really proud of how we've adapted. All of this information is available on our YouTube page. When I'm not talking to you all, I'll drop our YouTube page link in the chat. And then do you know that AHA leads? On the left side of this slide is a list of our interest groups. I want to note that the behavioral health interest group is a new one and we are excited, but if you count them, there are 6. We're almost an octopus when it comes to interest groups. We also host quarterly meetings that we're sitting in now. In addition to all of those awesome meetings that we are providing, we're engaged in a lot of other areas. We contribute and participate in regional health alliance meetings and state health alliance meetings to stay in touch with what other health alliances are doing across the state. We help problem solve together, and when possible, we apply for grant funding together at the same time too. We serve on the steering committee of the Metro Area Social Health Information Exchange, which is an exciting effort facilitated by the Colorado Health Institute. We have our hands on e-consult transformation at the state level. We continue to advocate for e-consults because we feel like it's a great way for organization or for providers to grant access to those who might not be able to get into a specialist. We are, it's nice that Megan just presented right before this because we were involved in vaccine hesitancy outreach. And we are just stepping into examining ways in which we can support efforts with the unhoused community in Aurora. I will end with our upcoming meetings. Did you know we have a bunch coming up? So we have a 2-part series on addressing youth suicide. That'll be in August and September. We can, if you go to aurorahealthalliance.org, you can find our calendar and register for all of these events or in our newsletter. We have 3 upcoming meetings the next 3 months for interest groups. So our social determinants of health group will be hearing from B-Chart and the pandemic of love. Senior Circle is meeting in September, and access to specialty care with a focus on rheumatology is in October. Our next quarterly meeting is also in October. And I just want to thank our AHA staff. We're a staff of 3 part-time folks. We do a lot, and we couldn't do any of this without all of you. So if you have any AHA questions, you can send them to me in the chat or ask them now. Otherwise, I'll transition to community announcements, and Heather will facilitate that. So thank you, guys.
Wow, that was a lot. Mandy.
I timed myself. My timer went off and I wrapped it up.
Yeah, Aurora Health Alliance, as you can see, has been incredibly busy doing a lot of different things. And so a second shout out, we are on the same page today because I was going to give a shout out as well. Just a shout out to the great staff, because it is a lot of work, and you know, our staff works part-time, but it is definitely full-time work. So a lot of really awesome things that happened, and we were able to kind of pivot during COVID times, and a lot of really neat things on the horizon, especially this fall with some upcoming meetings. So thank you for giving such a great overview of all the great work. We'll go ahead and open it up. This is our time where if you have something that's happening with your organization that you want to make sure everyone's aware of, you have any other kind of community announcement, we want to give individuals the opportunity to share that. The other option is if you want to drop it in the chat, if you have a flyer or an announcement, you can do that as well.
This is Allison Somerton. I'm just reminding folks that there is the special enrollment period available for people for Marketplace Health Insurance through August 15th. And if anyone needs assistance or more information, we are at connectaurora.org. My name is Allison Somerton, and I'll put our contact information in the chat.
Great, thanks, Allison. Just wanted to thank everybody for joining, and we here at AHA hope that you enjoy the rest of your summer, doing something fun or unusual or creative, whatever it might be. But thanks for taking the time to join the quarterly meeting. We'll go ahead and adjourn. Thanks, everyone.
Thanks all.
Thank you.
Thank you.